In this video, I will focus on reviewing notifications and taking you through all of the different sections here of the notifications tab. So I'm now in the notifications tab. As you can see, there's 4 different alerts here. So I've changed the dashboards and I'm now in a currently active doctor's dashboard. And that's why, as you can see, all of the areas are redacted. So obviously for privacy purposes, we are not able to give more information than that, but that will still give you a lot more of the detail about what type of information you could expect when the patients are being monitored. So the first thing that you can see here is that there is a message here, and this is where you'll find personalized messages or private messages from patients that they'll be sending you directly through their app. And that's why it's quite important to ensure that you do log into your notification center, into the dashboard on a daily basis, perhaps even more than once a day, just to make sure that you are not missing any of the messages from patients that are waiting for an answer. And then additionally, you do have clinical instructions, and that's where you'll find all of the information that the system reports on once the scan has been assessed. So if we jump back into the messages, as you can see, there's a direct message from the patient, and they're asking them a little bit about just about some estimate and how many more aligners would be involved. So there's just an example of a message that could be received. And then by clicking on See Full Conversation, it will then take you into the patient's profile, as you can see here, and it will pop up here in that communication center here. And from here on, that's when you'll be able to answer the patient directly and perhaps even use a quick reply depending on what type of question they're asking. So there is an opportunity of presetting some of the automated messages or like templates for messages that you could then utilize when you're writing back to the patients. But in this case, obviously, it could be written freehand. So that's the communication panel. That will always be there, and all of the information that the patient sends you and all of the information that the system sends to the patient will be in the communication panel in the chat form. So you can at every point go back and just, review every communication back and forth that has been recorded for that particular patient. So if we jump back into the notification center, this is, as I've said, that's where you'll find the personalized messages. If we now click into the clinical instructions, this is where you'll find all of the information that was detected by the system. So in this instance, you can see there's 3 clinical instructions. There's for 3 different patients. So as you can see, this particular patient is actually on aligner number 33 currently. This patient is on 13, and this one is also on aligner number 13. So some of the examples of some of the clinical instructions that you will be receiving are spots and teeth still present. So some spots and teeth have been detected. In this instance, slide and seat still present has been detected on 3.3. So slide and seat, as mentioned in my previous video, is a degree of an unseat, which is ultimately the gap between the aligner and the tooth that the system detects. And based on that, following the instructions that we have preset for the system, will then provide patient instruction and then also provide team instruction. So in this instance, this is just an example of some of the messages that will be received. And for this patient, it's a noticeable unseat, which is a greater gap between the aligner and the tooth. For 1.2, in brackets, it says ignored. So this is an example of when the tooth has been excluded from the protocol. And then there's also a noticeable unseat that's been detected for 2.2. So all of these notifications, you will not need to review. This is primarily will be done by our concierge service. However, it's quite important to ensure that you're kind of able to interpret all of this information, particularly in the instance where a patient is just not compliant and something needs to be escalated. So, for example, let's click into this patient and have a look at their dashboard. So this is an active dashboard for an active patient. And as you can see, the first thing that I can see here is that they obviously went through their first aligner set. There was a bit of a gap, and then they continued on into their second aligner set. So they're currently on aligner number 13 out of 16 aligners. And from also what you can see here is that you've got the top row are the aligner numbers, as I mentioned before. You've got a collection of green circles and red squares. Green circle represents a go, so that's when the patient got a go. So overall, you can see that this patient has been pretty compliant. They've been doing a good job progressing through their aligners. The second row is their oral hygiene. So the first thing that you see is that this patient has just had oral hygiene really good all along the journey. And then the last row is where you see how compliant they are in taking their scans on time. And mostly they've been pretty good, but as you can see, there's been a few instances where they've had a little bit of a delay. And when you hover above it, it will actually tell you how late they were for a particular scan. So in this instance, as you can see, they were 1 to 2 weeks late. In this instance, it was 2 days to 1 week late. So it kind of gives you a bit of a snapshot view of how the patient's progressing through their journey. What this timeline also shows you are the 2 sets of scans. So the scan on the right-hand side is always the latest scan. So that's the one that the patient's taken last, which is the one on the 26th of September, which is today. And then on the left-hand side is any other previous scan. So even if you wanted to drag it all the way to the beginning of the journey and click on that very first scan, you can do that just by hovering above it and clicking it, and it will be able to show you exactly where the patient started and how far they've come along through their journey. So this is where it's really interesting to, click into your patient's profiles and just having a quick look to give yourself a bit of an understanding of how well they're traveling through the journey. So as you can see here in this particular timeline, there's been quite a few red squares, meaning that there's been some no-goes or where the patient has been asked to stay in that current aligner before progressing onto their next aligner. So in the instance where the patient is getting, perhaps they're just not tracking, they're not doing so well, like in this instance, they've had some issues with their oral hygiene, or let's say there was an instance where they've gotten some no-goes more than once or more than twice, or sometimes even more than 3 times in a row. That's when the concierge service will be able to flag it with you for you to look into this patient a little bit deeper. So perhaps maybe you could contact them directly or bring them back into the surgery so you could actually have a discussion with them about how the treatment's progressing. So the way that the concierge service will be doing it for you when they're reviewing these notifications is adding this patient to the to-do list. So for example, if they wanted to add this patient, all they do is just click on the to-do function. They can add a particular comment about this person. Perhaps in this instance could be, please contact the patient regarding oral hygiene concerns. And then you'll then just add them to the to-do list. Once you've added them to the to-do list, they will then pop up in this top tab here. And that's why it's quite important to ensure that on a daily basis, you click into the to-do list and you have a look and see as if there's been any tasks that have been added by the concierge service for you to address. So this is one of the things that you will need to look into on a regular basis to ensure that patients are not being missed, or any of the information is not being missed, and all of the non-compliant concerns are being addressed.